Hey everyone, good afternoon. I think it's afternoon just about everywhere. Welcome to Group Dentistry Now's DSO Study Club. Uh, we are going to spend the next hour together speaking about predictable revenue models. And a lot of great questions that came in from all the registrants. So we appreciate that. We've got a ton of them. We're going to hold those off till the end of a little bit of this discussion here that we have, which is going to be focused on predictable revenue models. So I think we're going to answer a lot of the questions that came in anyway. What I'm going to do is probably about 2 more minutes. We're going to let people file in and then we'll get things started. We've got a ton to cover here. And we have with us Travis from 7 to 7 Dental and Melody from Signature Dental Partners. So thank you both for being on today.
Thanks for having us, Bill.
Yep, thank you.
We've also got some polling questions. So I've got 5 poll questions for you all. So to keep you all engaged, we'll ask those. They're easy questions, so there's nothing too difficult. And just to get an idea of where you are as far as number of locations, so we know who our audience is. We'll talk a little bit about insurance versus cash pay, a little bit about predictable revenue, some of the polling questions there, touch on dental membership programs as well. This webinar is being recorded, and I get this question a lot. I had a couple emails that came in prior. Can't attend. Am I going to get access to the video recording? So yes, there'll be a video recording of this. It will be on the groupdentistrynow.com website in the webinar section. Probably an hour after this is recorded, we'll upload it. It'll be on our YouTube channel. And then everybody's going to get an email tomorrow at 3 p.m. Eastern, exactly 3 p.m. Eastern, that'll have a link to the report that we're going to reference quite a bit here today, which was it was a survey of 105 DSOs that Cleary did with Becker's Health, and really it was actually called the DSO profit squeeze, and addressed flat reimbursements and rising costs. So we'll dig into some of the data that came out of that. But if you want the entire report, we'll have a link at the end that you can download that, and then also a link to it actually at the end of this presentation here. So I think we're 3 minutes in, so we'll kind of get things kicked off here. So I think what I'll do is I will let Travis DeZuba and Melody Bennion introduce themselves, talk a little bit about their backgrounds, their roles at their groups, and then a little bit about their groups. So Melody, why don't we kick things off with you, and then Travis can kind of take it from there.
Thanks, Bill. So I've spent the last 18 years in dental operations. It's about 50-50 of my time into private practice and then in the DSO. The majority of my recent work has really been focused on training operators across the DSO. What I've really become passionate about is how small operational behaviors, especially at the front end, can really drive great differences in production, patient experience, and that long-term growth we all want to see. And I love seeing that there's not one thing that triggers success. It's really we habit stack behaviors with consistent training, and that can really take a practice from good to great. So that's what I love doing every day.
Thanks, Melody. About Signature, where is Signature located, and what type of dentistry do you do there?
Sure, we're located out of Phoenix, Arizona, and we buy practices in the Western United States and just general dentistry.
Great. Thanks, Melody.
Yeah.
Travis, a little bit about your background and your role at 7 to 7, and what does 7 to 7 do?
So we're in San Antonio, Texas. I've been here for 10 years marketing for 7 to 7 Dental. We do general dentistry, orthodontics. We have some specialty mixed in there, trying to create our own ecosystem with that, and community-based marketing, the digital, just all fronts. Really exciting stuff. Once I came on board, we weren't doing a ton, and our CEO kind of opened it up to me to run with it. And he and I have the same background, so he understands the value behind a lot of the marketing efforts on that. And so just anything and everything. That's why I'm excited for AI and all this other stuff that we can have automation with some of the advertising and marketing aspects of things. So
Thanks, Travis. Yeah, and it's nice to have both your different perspectives. Melody, we talked about it off camera before we actually kind of went live here, the importance of integration and training. And I think we'll touch on that today and also the importance of marketing when it comes to, retaining patients and then also trying to get new patients. And sometimes it seems like there's a lot more focus on getting new patients than it is keeping the ones you already have. So I think, I'm sure we'll touch on that today. But all right, let's get started with a poll question, and then we can jump into this survey that was done, and then we'll start to talk about some of the findings, some insights that we've seen there, and I think it's pretty interesting, and it's all related to revenue growth. So we've got first question is super simple, number of locations. So anybody can answer this one. I've going to give everybody, like 30 seconds here. Let us know you have one location, you have 100, you've got somewhere in the middle. It just gives us an idea of who's on the other side there, and hopefully we can adjust some of the answers to the questions and some of the questions actually. Here we go. It's always fun to see this on the other side, the different bars going up and down. All right, couple more of you. I can see a couple haven't answered it, so if we can get a couple more. Okay. Let's see here. All right. Now I've got to do this, which is end the poll and share the results. So can everybody see the results here? So it looks like we've got 41% are fewer than 5 locations. We've got 30% between 5 and 20. And we've got, looks like a couple that are in that, let's see, we've got 18% that are 21 to 50. So a real mix here. But it looks like it's more on the emerging group side than it is larger groups. So appreciate everybody doing that. I've got one more that I'm going to ask you now, and then we're going to jump into some feedback from Melody and Travis. So one more here. This one is related to standardization of cash pay. So how standardized is your approach to engaging uninsured or cash pay patients? So in other words, are you standardized at all? Are you fully standardized? And if you're saying that, are you really honest about that? It'd be great if you are. All right, let's see here. I always like to see this on my end here. I'll give everybody about another 15 seconds, 20 seconds. Okay. Got one fully standardized anyway, so that's good. Let's get end the poll here and we'll share the results. So it looks like there's some level of standardization. So it looks like almost there's only one person that was honest to say we don't standardize at all, and another that says they're fully. So everybody's somewhere in the middle. Travis and Melody, where are you? I mean, do you feel like you're pretty standardized at this point across all locations? Melody, I can let you kind of answer that first.
We fall right in that 50% standardized in some regions or groups.
yeah, we're kind of fully and standardized in between both of those there. You kind of have to be for consistency's sake.
And are you all trying to, get to fully standardized, or you feel like that's something that's not necessarily achievable, but a lofty goal?
I think it's more of the people at some of the offices maybe not having you bring on new people, and you got to train them. And I'm sure Melody can attest to this, but some of those people may not have the confidence or the know-it-all to kind of articulate the message on some of those things. So if we're going towards a membership of some sorts, they were presented the tools and maybe they forgot them or continuously need to be reminded of some of those. But that's where I'm kind of saying we're fully, but it tends to gravitate towards in between both of those because it's just not everybody picking up on the things we're putting down.
Yeah, there's so many things to implement. We really have to pick and choose and be strategic. And, is it a current AI program we're implementing? Can something like this wait? So we're kind of constantly balancing what are we driving at the moment.
Yeah, and as far as so Melody, I mean, your role specifically is to help integrate, right? So you're trying to standardize, and as you acquire a practice, how long does it take to bring a practice, where I don't know if they're fully not across everything, but in general, you can say, hey, they're doing pretty much everything that we'd like them to be doing, and that the group is doing as a whole. What's the time frame on something like that?
It's pretty easy to get everyone in our payroll software, move all the vendors over in a few months. Everyone can be comfortable with that. I would say upwards of a year. You could pretend that we live in a world where you could jam everything on everyone and immediately have compliance, but they come to us doing certain things and needing certain fixes, and we just have to slowly work through in a good at a good pace so that people have buy-in and have energy to work through everything with us. So it takes some time to get everybody really onboarded nicely.
Excellent. All right, let's jump over here. Thank you for the responses for the poll. We've got three more, but we're not going to ask those now. We'll scatter them out throughout the webinar here. And so again, I mentioned this. There was a study that was done through Becker's Healthcare with Cleary. They surveyed 105 DSOs. I think 80% of those, I've got actually the report right here. 70 were actual large DSOs, what they consider large, don't say what large is. And 30% or 20% were multi-site dental groups. So I would think emerging dental groups. So like a lot of you in the audience. And then there was another 10% that looked like there were solo practices. So a lot of larger DSOs actually were surveyed here. And so, in this question or topic, the hidden cost of variability across locations, which is kind of what we were just talking about right there, right? With that survey that we just did, or that poll. Interestingly enough, 81% of DSO said they lacked a standardized patient engagement strategy. So specific to patient engagement, 81%. So I think everybody out there that answered that poll question, just know you're not alone. You're in good company, because a lot of the larger groups out there are kind of in the same situation. So you've got a situation where there's practices in a lot of cases are doing things differently, and can really cause issues within the group or the practice as far as just margin pressure. How do you forecast something like that? That's got to be really challenging. And of course, there's really no way to really measure that either. So I think that and it causes revenue inconsistency. So Travis, I'll start with you here. And also, I know I mentioned this earlier, but for anybody that jumped on, because I saw we had a bunch of people jump in a little bit later, so we kind of started to get things going. If you have any questions, we've got a Q&A area. Please just shoot them in there. We had a bunch that came in ahead of time, but if there's something that Melody or Travis says and you want to kind of address it, we can do it right away. So feel free to type it in there. If we don't get to it for whatever reason, one of us can follow up, whether it's me or Travis or Melody. We'll follow up afterward, unless you're anonymous, and then we don't know who it is. So if we have to kind of know who it is. But if you want to be anonymous, you can do that too. We'll still try and answer it live. Travis, where do you see the biggest disconnect between marketing strategy and the actual in-practice execution?
I'd say it's, once the patient comes into the office. So a lot of places you've got to make sure that whatever your message is that you're marketing to the community is also being conveyed when they come into the practice. And there is some sort of disconnect because, again, there's many hands changing depending on what the scale of your business is and how that training was carried out. If it's standard, if it's kind of hit or miss on some of these, what are their focal points? Are you, putting everybody in the same bucket saying, hey, the standard collection rate of something needs to be 80, 90, 100%, and everybody's held to that same standard. All of those different things. You got to measure everybody, I guess, with the same ruler. You're not just picking and choosing this office or this one has to be at these sorts of levels. And the training that, combats those that aren't doing as well. So as you scale, obviously the hidden cost exponentially grows with that. So small things really snowball into a ton of lost revenue.
And Melody, from the operational side of things, when you see inconsistencies there, which ones do you think mostly directly impact financial performance?
I think that if every patient experiences a different version of the practice, then we've got a big gap and a big problem. We want to craft our patient experience and our day with our team to make sure that every patient every time has this same ex like exceptional experience. Um, with intake on the phone, did we just take their information and get their name and their number and their insurance in the schedule, or did we create value for our practice? Did we talk about what sets us apart and makes us awesome? And then when they came in, was our practice clean? Did it smell good? Did everyone smile and make eye contact? Did they feel like they truly had an exam and were listened to by a doctor? Then at handoff, did they understand everything that we recommended? Do we give them financing options? Everything that we do in that visit we've crafted for them is going to increase our case acceptance and get them on our schedule. And if we haven't done that, we're going to have scheduling gaps and lose our production daily. So if we start in the morning with our team crafting our day with a great morning huddle that does more than just review what the day is, and everyone's synced up and we're ready for all of our patients, especially our new patients, nothing haphazard, just strategic and planned, then I have to believe we will pull in every opportunity with each of those patients that is possible for any dental office to be able to pull into a practice. So if it's sloppy and haphazard, we've got unpredictable revenue. And if that patient experience is so tight that every patient that comes is like, this is my office, why would I go anywhere else? We're just gonna keep growing and having that revenue consistent.
Kind of like Chick-fil-A.
Yeah, there you go.
It's my pleasure.
Yeah.
Is there a way to measure that on your side, Melody? How do you actually measure like that consistency?
We have some key metrics to measure. Obviously, are they rescheduling? How visits for doctor side, hygiene side. Definitely, we use software to make sure we're looking and staying on top of that.
Travis, do you do that as well at 7 to 7?
Absolutely. So you want to see the lifetime value of those patients and, are they returning as we go down the rabbit hole here with membership? Are they renewing that membership each year? Are they continuously coming to the practice? Are they spending money on orthodontics and, becoming a stickier patient in your organization? Do they trust you more? Those sorts of things. And so when you look at the numbers on them, it's a lot of the lifetime kind of returning on there. Do they come? We've had patients that have come to us every 6 months routinely for 20 years. And so we're doing something right, at some of those organizations for those people.
All right, we're going to jump to the next poll, and then we're going to talk about insurance, which is always fun to talk about. So we'll talk about this right here. I'll ask the question: what percentage of your revenue today is dependent on insurance reimbursement? And I don't have the stats, but I know I saw something from the ADA Health Policy Institute, and it was a pretty high percentage of dental practices where the question I think was phrased, are you dropping one of your insurance companies in the next year? And the percentage was over 70 some percent, I believe. So there are a lot of people considering dropping insurance. But how many of your patients your patient base is dependent on insurance reimbursement? Okay, I think we are probably give anybody like one more. All right, let's look at that. One more chance. All right, I got one more person. All right, let's take a look here. What percent of your let's share the results here. Again, what percent of your revenue today is dependent on insurance reimbursement? We had nobody said more than 90%. So we had 30% were in the 70 to 90% range. About over 50% were between 50 and 70. And There were a couple that were less than 50%. Melody and Travis, Travis, we can start with you. Where does 7 to 7 kind of fall in this?
We're definitely on the higher end, 90 plus.
Okay. So which we didn't get one person to respond to that. So if you would have you would have taken the poll, it would have been one. So
Yeah.
how about you? What about signature?
We mostly take offices that come to us, so we're a real mix.
Okay, so it just depends on the office. So some are probably a lot more fee for service cash pay, and then others are heavier in insurance.
Yep,
Yeah. And that must be challenging as far as consistency goes, right? Because it's like it's a different revenue model.
absolutely. Yeah, you have to look at it a different way when you're fully out of network with everything than if you've got all 17 major payers signed up.
So let's jump over here. The shift from insurance dependency to controllable revenue. So again, a lot of data in this survey that was done through Becker's and Cleary with 105 dental leaders, they say. So a combination of DSOs and some emerging dental groups. 50% of the DSOs reported declining reimbursements. I think we all know that, right? Declining and a lot are flat. I think we know that
Mhm.
there's not a lot of increased reimbursement when it comes to insurance. And 96% of those DSOs said they were serving some uninsured or underinsured patients. Makes sense. So you've got this declining reimbursement rate. You do have this pool, depending on what type of group you are. Some seem to have quite a few cash pay patients, others don't have quite as many, but there's still an opportunity there. And it's a revenue that if you handle it right, it can be very, very predictable. So we're gonna talk a little bit about that. Um, I think what we talk about here is a little bit about, the focus from you, Travis, and marketing efforts, because a lot of times marketing efforts are focused on patient acquisition and not in patient retention. So, do you have a strategy you could recommend and maybe kind of rethink that marketing strategy, patient acquisition versus retention?
Yeah. So the new patient is the shiny thing in the office, right? And everybody loves new patients, and you have to have them if it's a growing office. You need new patients for sure. So I'm not going to bash on not having new patients, but they're the ones that trust you the least, and they're the most expensive. So when it comes to whatever your new patient cost is, it's going to be exponentially more for a new patient than it is for somebody returning to you. And the ones that spend more money with you are the ones that trust you, the ones that keep coming back to you. And much like Melody touched on, they have that great experience with you and they want to keep coming back. And then they want to get orthodontics and they want to get whatever other services you're offering, right? So you have to have insurance. Obviously, there's some really great ones and some there aren't as many great, right? And so with that, we take those uninsured, underinsured patients, and we don't want to tell them that their baby's ugly. They live or die by their insurance sometimes. And what we want to do is ultimately provide them with a better coverage, right? And so we'll then position that dental membership program for these people and saying, hey, you're tired of paying your deductible, you don't have to do that with our membership. You're tired of paying or hitting your annual maximum every single year, you don't have to do that with this membership program. Any waiting periods, you have a lot of work that you need done, you don't have to do that with this membership program. And then I'll devise a marketing campaign just to target these people, whether that be through email or geofencing around their homes. There's crazy technology now that you can use to target these people and really get the most out of them. They already came into your office, had a great experience. So just switching that from paying whatever insurance and not really getting much from it to joining on our recurring revenue membership program.
And Travis, how long have you been using a membership program?
It's been way before my time here. Justin, our CEO, started it probably 2009, and it was very archaic. It was on an Excel spreadsheet, and it was an annual fee, and that was $200 to $300. So that's a lot of money for some of these people to pay all at once. There's no way to really track it if it's an Excel spreadsheet, and we've got people that were on there for multiple years, paid one time, kept coming back. Nobody was able to really track it because it was in Excel. And point being is they saw the value of having some sort of coverage way back then, right? And so having that become a revenue model with everything else that we're doing made absolute sense from a long time ago.
And then you switched over from doing what sounds like an in-house plan, right, on an
Right.
Excel spreadsheet to using a platform like Cleary. Um, and we'll talk a little bit of that. We'll talk about that in greater detail. Melody, on the operations side, talk a little bit about, how you see when you look at patient retention, uh, where do you see operations fit into patient retention, and where do you see, where there may be issues where somebody doesn't come back, and is that a front desk issue? Is it a provider issue? Where do you kind of see the breakdowns occur?
So, if we've started with that strong crafting of the experience in the front end, and we've got a great website and the Google reviews are great, and we've all those things that they've interacted with before they've even called our office, those are strong. And then we've got that great intake phone call and experience for the patient. So by the time they're back at the front desk, they've had a great visit. But then it can really drop off, after a diagnosis. Maybe the next step is not clear. Maybe the handoff was poor. Maybe the administrators have financial conversation discomfort. Maybe they don't have any financing options to even offer. And then no structured follow-up process. I love training teams. When you're checking them out, you've given their treatment plan. And they didn't accept it. Did you even try? Did you say, hey, could I call you in a couple weeks to see where you're at? Or you said you needed to follow up with a spouse. Let me text you in a couple weeks and see if you've had that conversation and we can get going again. If you're just asking for permission, it makes that next step of following up very easy because you already know they said yes to you. Whereas if team members just accept the no, then it's very hard to follow up. And the next time they get followed up with is in 6 months when they come back to your office again. We just can't assume if they want it at this point, they'd schedule it. And then it's out of my power, but it is in your power. And in those very essential, but kind of, I think sometimes people think of a DA or a hygienist as like sort of the in-between cartilage here, but the dentist job, of course, is to diagnose and explain to the patient why they need it. And then they think, okay, now it's the front desk job to just present the treatment and sell it and get them scheduled. But an assistant or a hygienist can definitely play a really awesome role in there of how was your visit today? What other questions do you have? They can really help make sure they stop at the front desk. I know you're in a rush, but I really need you to stop and talk to my friend here for checkout. All these different things. We all as a team need to develop the value language and the talking and the speaking soundtracks with the patients to keep the ownership to the whole team, the accountability, that urgency that's shared by the whole team, not just two members of the staff. So we can retain more patients when the whole team is super bought in, sold that they have a role to play here.
So maybe we'll start with you on this question, Melody. So since you have practices that are, some are much heavier when it comes to insurance than others, some are heavier, more fee for service cash. How do you know when a practice, is overexposed? Like there's just too much insurance volatility there, and what can you kind of do to alleviate that? Are there any signals that you see?
I think the biggest risk is when they only have a single payer. I don't know that I'm allowed to say the name of that payer, but I think you probably all know what's the biggest one that everyone signs up with. And so I used to think when we bought an office and they only had that payer, I thought, oh, they're so great at these conversations with other, all the other insurances to build up this practice where they only had to take this one direct contract. And then I learned that's not true. That's the whole practice is 70 to 75% of the practice is tied to that one insurance. And so then you are so vulnerable to the executive decisions that company is making around fee schedules and reimbursements. So I think it's just being really intentional and strategic with your payer mix. Like, are you aligned with the major employers in the area? Are you participating in plans because they're easy to sign up for? you need to go back and look at them. Can I ask for a fee schedule increase? Are they giving it to me? How many patients do I actually really have on this low paying plan? Maybe that's the one to start with and get out a network with that and fill the seats with the insurances that you want and create that opportunity for there to be some cash pay patients and use a service like Clary to pull in that predictable revenue that you get to control because you're doing it off your own usual and customary fees.
Travis, any insights from you?
Yeah, she's exactly right. I mean, if there's too much, of one particular carrier, then you maybe need to go and find someone else that works with your business. And so luckily there's more options now than there were, 5, 10 years ago. And so the technology you've got now, you can go and find, like she's saying, those employers that have the insurance you want and negotiate different contracts based on the utility of some of those. So basically now we have a little more say in some of these conversations than we did in the past. And so that's what ultimately is benefiting, I think, a lot of DSOs nowadays.
Excellent. All right. Uh, Poll time, everybody. So next poll, we've got two more left. Predictable revenue. That's what we're going to ask about here. So how confident are you in your ability to predict revenue performance across all locations? So again, this is a little bit more. Okay, it's always fun to watch this. You don't see this on your side, do you, Melody and Travis?
No.
Yeah, we get this. Like I get to see the bars going up and down as people answer them. So I just get to show you the results like everybody else. But it's just kind of it's fun to see this. Let me ask you this while we're waiting for some people to respond here. Travis, any prediction on what you think we're going to see here as results based on who's in the audience?
I'm going to say limited.
What do you think, Melody?
Yeah, probably somewhat to limited.
Okay. You too. Are you sure you're not seeing these on your end? Because that's pretty good. All right, let's share the results here. So we literally had nobody answer very confident and nobody answer not confident. So everybody's somewhere in the middle. Would you kind of feel like your groups are in the same boat, or do you feel a little bit more confident? Like what is Melody at Signature feel?
Um, can you state the question again? Sorry.
Yeah, it's just how confident are you in predicting revenue performance across like all your locations? So do you have a pretty good insight as to like the predictability of the revenue?
I think actually we're pretty confident. We've, identified what will really hurt our revenue, mostly provider days taken off. Gotta make sure everyone's working. And then, within dentistry, I know there's certain months that we believe are, poor months. Like January is a strong month because insurance is renewed, and September is a bad month because everyone's back to school and people are busy. So, there's the kind of ebb and flow with those traditional months in dentistry, but I think we can definitely counteract that with marketing and programs and things to make efforts towards addressing those ebbs and flows.
Travis, how about you?
Yeah, absolutely right. So, same with the months. Everybody wants to talk about the great ones, and then there's obviously some sprinkled in there that aren't so great. So, predicting how you can combat those, obviously doing that proactively and not waiting till it's September and no one's in your chairs and trying to hurry and get them in there, right? So, all of it's based on technology and reporting. And I guess you can look at both sides of this, say, hey, unfortunately, dentistry is kind of behind the curve in healthcare when it comes to technology and reporting on some of these, but at the same time, there's a lot of emerging technologies out there that are coming up and saying, hey, we'll work with you and we'll get every dashboard and reporting, all these statistics that you need and want. And so that's what I'm excited for, is to say, hey, we can predict a lot better now than we could a few years back because we have all of these capabilities now. And so looking at that and saying, yes, we've got certain offices that may do better than others and just based on if they're an anchor office or not. But at the same time, can we say, hey, this month is going to be great or the next one's not going to be so great? And so predicting that helps staff and profitability and EBITDA and all the stuff that's kind of tied together there.
So as we jump over here, strategy fails at the practice level. So this is really kind of, I think, ties into that poll that we just did. So 81% of, again, the people that were surveyed, which were DSOs for the most part and some emerging groups, 81% see cash pay revenue potential, but only 19% have standardized execution. So I think, you've got strategy versus performance, which, is definitely, a real challenge. And I think there's a couple things going on here. And Travis talked a little bit about the marketing efforts to get people from being cash pay to becoming membership plan, right? Where you get that predictable revenue, because with people that are cash pay, you have no idea, right? I mean, they might just come in for cleanings and that's it. They may have some big expense, but when you have that predictability where you've got, you've got a family plan, let's say, and the family's coming in, and there are certain discounts that they may get for orthodontics, or if they have any big procedures. First off, I think, there's a lot of data out there that shows that, patients that have these membership plans are much more sticky. They're more likely to stay. When we talked about patient retention, if they have a plan, they feel like they actually have in some way some type of insurance with that particular, insurance in quotes. Because I think dental insurance sometimes can be dental insurance in quotes anyway. It's a lot different than what we consider insurance, I think, if you look at medical insurance. But it seems like there's opportunity, but as far as execution goes, not doing all that well, at least the people that were surveyed. So, Melody, I'll ask you, talk about some maybe well-designed strategies, and you handle integration and rollouts. So maybe you can talk about where a strategy might break down during a rollout and where you see some issues there.
Yeah, I think it's so much to do with how we handle it with the team because they're the ones who have to execute it. We just have given them this option and presented it to them. So when we roll out the idea, and do they hear extra work, or did we create some excitement, some momentum, some buy-in from them for them to understand why this would help them? We have to help them understand it will make my life easier. I want to participate in this. And then we do have to, reinforce, continue to train, and continue to hold people accountable. And I think the best way to do that is to help them embed it in their daily workflow, which I love the morning huddle for that. Let's make sure every morning we're discussing how we're going to do this thing. And there's so many tools, like Travis was saying, there's awesome AI out there, but we do have to carefully evaluate all of it. And I think we've got to pace it, integrating it into our offices at the right flow. We maybe at the DSO level have energy to evaluate it all and say, hey, all this is great. Let's do these 5 things, but we can't do 5 things all at once to a practice. So just that pacing it and teaching them why it matters and how it will make their life easier is going to help us keep all these systems we're integrating into practices repeatable for the future.
Yeah, that's a really great point. So, Melody, when you have initiatives, right? So like there's a new solution out there, there's something new you want to bring to the signature dental practices. You can't do everything all at once. That's be a disaster. So how do you determine like what the initiatives are? And in general, like over a year, is there a certain number? Like, are there like only 3 or 4 things you can possibly do and roll out? And as you scale up, it probably becomes fewer and fewer things that you can do. I don't know, just speculating, but is there a number? And then, how do you kind of break things up as far as rollout? Like, let's get this out first, and then we'll move on to the next initiatives, or can you have multiple going on at once?
I think, it just depends. Is it like more of something that's going to land on the clinical team? Obviously, the front desk or the office manager is usually like our key connector to that. So their bandwidth is one of the first things we have to see where they're at. But then if it's something that they can just help us coordinate, but really it's on the clinical team, we can do a little bit more. But if it lies heavy on front desk tasks, then I'd say you probably every month or 2, realistically 2, at least you have to give them a little breathing room in between things.
For sure. Yeah. Yeah. So it's a lot of change management, right?
Yeah. Yeah.
Travis, from your perspective, how do like your marketing efforts align as far as like operational workflow? Like how closely do you work with operations? You pretty much in
Mostly,
sync?
yeah, you have to be. So again, what we're pushing out to the public has to be also reinforced on the back end when they come in, right? So our biggest thing is we're convenient, we're customer service focused, we're 7 days a week. So if we push all that out there and then somebody calls in and it's inconvenient and it's not friendly and it's, all the things that we go against, that doesn't really reinforce the operations and marketing altogether. So we work closely together and in ensuring if there's anything fallen by the wayside, we can find a way to pick things up. But much like Melody said, understanding the why is the biggest piece of all of that. And so adding something to someone's plate that is making, an hourly wage and doesn't always want to be there, it seems like a completely just flip their entire day on its head scenario, right? So getting them to understand the why, if you can somehow come to it was their idea, that's the best scenario is, oh, hey, this is very tough and whatnot. And they comes up with the same idea that basically your idea was. Those are always great breakthrough moments. But yeah, work very closely with operations.
And Travis, what does marketing success look like to you when it comes to, a new initiative when you roll something out? Do you have a way to measure that?
Yeah, so you've got to find, I guess, what your, return on investment is. And if you want two, three, four, five times whatever you're putting into it, if it's a community-based thing, how many lives did you help out with free dental care? There's so many different avenues you could go down on one of those. And ultimately, it's what's the technology that can track some of this. If we're pushing out digital ads on Google or Spotify or whatever have you. We're working on this, but trying to get that all the way down to a granular level that says, hey, Bill spent, $3,000 with us off of a $2 ad, and we're trying to find those sorts of things out. And can't do that manually. We got to do that through technology, right? With the scale that most of these offices are looking at. And so for us, we're working towards all of that. But for right now, I mean, keeping our finger on the pulse as far as hygiene patients go, that's the big driver of everything. Those are opportunities that tells you where the health is and if our marketing's working. And that's ultimately all it boils down to for us.
How about you on the operations side? What's success look like, Melody?
I wish I lived in a world where I could say it's everyone 100%. That's what it is. But if I've got 10 to 20 outliers, I'm pretty happy with, 80% adoption. It is fantastic. 50 to 80 is realistic, I think. I call that a success.
There you go. I like it. 50 to 80. That's honest. Okay, let's move on here, and then we are going to get to. Well, I promise we'll have some time. Hopefully, we'll have about 10 minutes left for some of the questions that came in because we had a bunch that were really good, and we want to make sure we address those. But let's go into standardization as the new growth engine here. So, talk. This is kind of what we've been focused on right here. How do you standardize? Uh, versus being rigid, right? You don't want to jeopardize the culture that you're building and maybe, force certain things. So you don't want it to be forced. Um, are there things that should be centralized and some that should still stay local, practice by practice? Melody, you talked about that, right? You've got some that are, much more fee for service, where other practices are more insurance based. Um, what this is Melody, this is for you. Operational frameworks that can kind of enable that consistency without losing culture.
I think it's just that we have to enforce the best back to basics. We need them to do that. That's not culture, that's just running a good dental practice. There's It's fun to see all the AI come out and meet different vendors and things, but the core of how to run a good dental practice, the fundamentals, those really haven't changed over time, I don't believe. And so if as long as we keep our focus on these are the things we do, non-negotiables, But hey, be really transparent. We don't want you to lose your culture. We want you to do it the way you do it. So if I want everyone to smile when they're answering the phone, I don't have to say, listen, you don't have to be cheery when you're answering the phone. Maybe this team is great at being cheery because they just are, and maybe you're just a little bit more flat, but people can still hear a smile. So I'm not asking you to be someone you're not, but I am asking you to do certain things that work. So we just have to make sure we're not being too exclusive in the way we're trying to have somebody do something and give them that room to be themselves still as an individual and as a team.
Travis, do you think standardization improves marketing performance?
Without question. So if you're pushing out different, ads or discounts or whatever have you for multiple locations, it's, depending on where those ads are being received, and there's multiple locations with the same brand, they may go into a different office and try and get a discount that isn't applying there, or the hours changing, or whatever have you, as far as the standardization you're looking for goes. It needs to be there for consistency's sake. If you have the centralized location, I mean, it's huge and easy for them whenever it's all consistent versus all over the place. And it's like, oh, hey, this one down the street does it this way, and this one does it this way. And we've got to, on the back end, go and kind of jump back and forth and do things differently. So that's the only way that you can scale and ultimately focus on the other things that matter, instead of having 10,000 irons in the fire. Maybe you can reduce a few here and there.
So Travis, and this one's for you as well, Melody. For the audience, we've got mostly emerging groups out there. People that have between 5 and 20 locations. I think that was the number that was pretty much over half of the people in the audience. Do you have 2 or 3 areas that DSOs should standardize immediately? Like, what are like the top 2 or 3 that you would say, hey, this is what you should focus on? Travis, why don't we start with you?
So I would say, if you don't have a call center, centralized location, whatever you want to call it, corporate office, start with that. And so by having that, you're alleviating your front desk receptionist from having any sort of, interactions with insurance and billing and all of that, and they can actually focus on the patient walking in. We also have HR and marketing and everything through the same building. But I would really gravitate towards that so they can focus on the customer service aspect of things at the office. Another one, again, we're talking about the membership and having some sort of, I guess, curb to some of those insurances that may not have the reimbursements that you want. So how are you managing it? Is it something that you're putting on the forefront of people's minds? Are you tackling those that are perceived, not as great insurance, or is it kind of just an afterthought that's in the corner and you're hoping that people see it and sign up? So those would be 2 of the big ones that I would gravitate towards.
How about you, Melody?
I think on financial conversation competencies. So are they clear? Are they confident? Are they consistent? Are we offering with clarity? Are we offering financing? Do we have those as options so that any patient that calls, ring, ring, do you take my insurance? We're not even worried about that. I'm going to share with you how great we are. I'm going to share with you how easy I can make it for you to come financially to my practice. And so that way we're getting all those, and that backs up to telephone training and supporting marketing. If we're paying for marketing and that every phone call that rings, we can't answer that question, how much should we just spend for the phone to ring and say, oh yeah, no, we're not in network with that one. Click. I've heard a lot of phone calls like that. But I'm like, we paid so much money to get that phone to ring. I want to know that when they go to those 2 classics, are you taking new patients? Yes, of course. And do you take my insurance? We, of course, will answer that question, but the patient, they don't know what they don't know. They don't know, they're asking the question they've been taught to ask. And we've got so much more for them than that. And as a team, we have to become really good at that conversation and take control, not let the patient have the ownership of the whole call, but we can jump in and start to talk about why come here. So that training on that end of the team is so vital for everybody. And I think where I see teams not make time in their day is the follow-up process when somebody hasn't scheduled what the doctor's recommended. So like I was talking a little bit earlier, it's asking the patient for permission to follow up, create a strategy. Teams do it all different ways. Is it the yellow legal pad? Do they do it inside the software? Do they make notes on the schedule in 2 weeks? Hey, follow up with this person. I don't really care how they do it. I just care that they do it and they make a system that works for them. And then probably the last thing is just making sure you have access to reporting and visibility for all your locations and tie it all together so you know what's happening in your practices and you can identify, where we need to pivot and move.
Okay, well, we're getting down. We got about 10 minutes left. So I want to get this poll question out, get a couple more things, and then I want to get to those audience questions. So this one's interesting for sure. This is about dental membership plans. So how is your organization currently managing your dental membership program, if you have one? So I'm always pretty surprised by this one, and maybe this is going to be different this time. But do you not have a membership plan? Do you do it manually, like Travis said? You've got a spreadsheet and you do that. You have an in-house program. Do you use your PMS to do membership, or do you actually have a third party? All right, we'll give maybe one more chance. A couple are coming in. There we go. All right. All right, we'll end the poll here and share the results. So we've got a even split between people that don't have a program at all or people that have something similar to Cleary or Cleary. And then we've got a couple in the middle, right? We've got some that are using PMS to manage their membership, and then a couple that are doing internally. So they've got their own in-house membership plan. Great. All right, let's jump over here and kind of look at membership as infrastructure and not a product. So, I mean, if you're standardizing membership, this is data from this Becker's Healthcare and Cleary report that was done. Again, it's called the DSO Profit Squeeze Report, 105 DSOs, dental leaders. And they got higher production from their uninsured patients, but they only 20% actually use enterprise-wide technology to scale it. So to me, that sounds like there's opportunity there for sure. If the production is 2x from uninsured patients, but you're only 20% utilization, right, of some type of enterprise level platform. So there's opportunity. We actually can see that here in the poll results as well. These are the last couple of questions that are related to this study, and then I want to get on to some higher level, questions that came in around revenue generation here. But Travis, start with you. What separates high performing membership programs from ones that don't perform well? And it sounds like when you were there, Travis, were you still doing in-house and you switched over, or was that already done?
Yeah. So I started in 2016 here, and we gravitated towards a new program in 2021. So it was 5 years of a ton of fun with Excel, and it was time to change. So I would say high performing ones are the ones that track it, see it as a valuable piece to their organization, not just kind of the thing in the corner, like I was saying earlier. So there's a ton of people out there that need it. We're in the gig economy. We see, hygienists that only want to work part-time. And so there's so many different positions out there that they don't want a full-time position. They don't get the benefits, obviously, with that, and yet they still need coverage. And so offering this is a great way for you to not have to worry about reimbursements all the time, right? It's still going to be, from what we saw in the poll, still going to be a substantial amount to your organization, but $1 from your membership and $1 from the insurance isn't the same amount. One, you got to chase down, and this one just comes straight to you, recurring each month. Or if they're paying for treatment on the back end of that, it comes to you instantly, either through a payment plan or through, their bank account. So for the membership, it's a huge piece for us. We've got about 5% of our patient base on there. I don't think we're going to convince everybody, from the 50s, dental insurance has been the big name in all of it. And so if we can maybe get 30% of our patient base. That's my goal, is to say maybe 1 out of every 3 patients in our organization could be on this membership plan. And doing that through targeting those with what we're saying is not as great of an insurance as they could have. I don't know what they pay, through their employer, but saying, hey, if you're tired of paying that deductible, if you're tired of having a maximum and waiting period and all of those things, you can jump on this membership plan. And it's great on the back end because we dictate the pricing on that. So whatever you want to charge, charge it, do it. So I think it's great.
Melody, what, from an operational standpoint, what do you need to put in place to have a successful membership plan?
We need to make sure our operators are building it into every patient conversation. So it's not, we don't wait to hear if somebody needs financing, we offer it. And the same with this. Even if somebody comes with insurance and we're asking for a referral, by the way, we have this great in-house membership plan. So it just needs to be part of what we do every day to become successful. And then for leadership, they need to treat it as a revenue strategy, not just like a side hustle. So we look at the numbers and evaluate it just like we track production or collections.
Oh, great. Yeah, makes sense. All right, let's jump over here. Last slide. If you want to download that full report and you've got your phone handy, because who doesn't, right? Just you can scan that QR code there and you can actually, there's a couple questions that are asked and then you get to download that report, or you can actually, if you want to just get a demo from Cleary, you can scan that. We'll have links that we'll send out to you as well tomorrow, so you'll be able to get access to the report. But I wanted to hit, I got about 4 minutes left here, and I want to keep everybody, honest and get you back to work at top of the hour. So first off, thank you, Travis and Melody. Great conversation. Really appreciate it. This is a kind of a real high level question here that came in, and a big question. We could probably spend an hour on it, but what do you feel is limiting same store revenue growth today? Is it patient volume? Is it case acceptance? Is it provider utilization, operational constraints? Travis, you want to kick that one off?
Yeah, I would say case acceptance for sure. So marketing, we spend a ton of money getting these people in the door. And if everybody's coming in and just getting their free hygiene visit, right, you're spending a ton of money to not really get much in return. And so by doing case acceptance, focusing on that, the verbiage, I mean, there's so many things you could put into that bucket, but it's not just your receptionists and other people that need the training on how to speak to people and use the right words. It's your doctors as well. And so if they go in there and they're using really big dental terminology with a patient that has no idea what they're talking about, if they're not using we use iTero for wellness scans, showing those patients exactly what we see, putting it in a 3D model, they can't read an X-ray. So showing them things that they can understand, and then tracking all of this. We've got a great software, Treatment 24/7, rebranding is Revy. Shout out to Bobby if he's on here. But it does a ton of work for case acceptance, ensuring your treatment coordinators are doing what they need to do. The doctors, where that sweet spot is. Are you over presenting, throwing the kitchen sink at people? Are you, not really? Are you missing some stuff? We've got Pearl for second, hand diagnosis on there. So I would say case acceptance, those are your opportunities, and really generating revenue from those, because otherwise, like I said, you're just coming in for your hygiene visit and that doesn't really do a ton of good.
Yeah. Melody, I'm going to skip around here on some of these questions because we don't have time, but what is the most effective program you have put in place or observed to drive referral business into your practices?
I think the most effective is not really the most complex, it's just the most consistent. It's just asking your best patients to refer. So I think that an office can get real traction with this if they reinforce the behavior with their team. Involve your team, have a staff meeting, make it a game, or create team-based incentives. So in the team, every single person on the team is responsible, even the dentist can ask for this too, asking for those referrals, then we're going to see that come into our practice, and make it easy. QR codes in the operatories for links to people to fill out to refer somebody or give to a friend, simple, clear prompts. How was your visit? How was your visit today? Oh, I'm so great. I know you love us. You've been coming a long time. You know what we really love? Referrals for great patients just like you. That really helps us grow. And encourage your team to be transparent. Say we want more new patients. That's how we grow our business. And we can stay here and take care of you. So, and it's not about scripting. Scripts start us off, so you do need to give those to your team to help them get going on it. But challenge them to do this daily, pick who they're comfortable with and get going. And just keeping it consistent. And that's going to move the needle in your practice. If every day everyone picks somebody to ask for that referral, you'll see that basically free growth right there.
Well, we're at the top of the hour, so I'll let both of you shout out the best way to get in touch with you if anybody wants to say hi or has any questions. Melody, what's the best way for people to contact you?
Emailing me is great. It's mbennion@signaturedentalpartners.com.
Okay, and we'll put that in the email, that email address in the email that you get tomorrow from us in case you want to reach out to Melody. And Travis, is email the best way to contact you?
Yes, sir. Travis.DeZuba at 7to7dental.com.
All right. Well, great. Thank you both, Travis and Melody, and appreciate and thank you, Signature and 7 to 7 for giving us an hour of your time. It was really enlightening, and thanks everybody for spending time with us, answering the poll questions. And I wish we could have gotten to some more of the questions that came in, but we did hit some of the bigger ones. Um, and thank you to Cleary, of course, for sponsoring this. Without them, we wouldn't be able to have these great conversations. If you want access to this video, it will be up on our website. Give us an hour to process it, and then it'll also be on our YouTube channel. And you'll get an email if you just want to forget about it until tomorrow. We'll send you an email and give you a link to it tomorrow. But thanks, everybody. Really, really appreciate it. And again, thank you to Melody and Travis for being part of this great conversation.
Thanks, Bill. Thanks, Travis.
Thanks, guys.